Hello and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Kwon Deok-chul, the Vice Head 1 of Central Disaster and Safety Countermeasure Headquarters, will be briefing us on the coronavirus situation. Now, let's take a listen.
Today's briefing will be carried out by Mr. Kwon Deok-chul, who is the Minister of Health and Welfare. We are also accompanied by Mr. Son Young-lee as well. We have sign language translation available for you. First of all, here is Minister Kwon Deok-chul on the explanation on the COVID-19 response. I am Kwon Deok-chul, Vice Head 1 of the Central Disaster and Safety Countermeasure Headquarters and the Minister of Health and Welfare. As of today midnight, we have 644 new local infections and 27 new imported cases. And yesterday, we also had 6 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. After mid-January, for the past 10 weeks, we have seen our daily tally hovering around 300 to 400. And during the past 10 days, we have seen a large and a rapid surge. And on average, we have seen 555 daily average infections, which shows that we are entering the signs of another possible fourth wave. And our reproduction rate is also increasing, and we have higher risks of local transmission. And in the metropolitan area and non-metropolitan area, we also have risks of widespread infections. And the situation is ever more severe here in the metropolitan area. And we have also, this week, we have a daily tally of above 400 as well. And in Gyeongnam and Chungcheong area, we also have a 200 daily tally as well. And this means that in our daily venues, we are being posed and exposed to the risks of infection. Meaning that there is no safe zone against the COVID-19 infections. And we are seeing small cluster infections that are continuing. And we also have cluster infections centering around multi-use facilities. We also have cluster infections regarding those people with contact with the confirmed cases, and they have spread the virus to other people throughout the local facilities and multi-use facilities. We also have many people who have been hidden sources of infection, and also nevertheless we also have a high level of fatigue against the prolonged outbreak. We also have many symptoms like fever or a cough or a cold or cold-like symptoms or chills. And despite these symptoms, people are going to work or they are going to multi-use facilities and also have been contracted with the virus afterwards. Even though they have also been recommended to get testings by doctors, they did not do so. And this means also we have a less loosened and eased practice of the social distancing measures as well. And many facilities, public use facilities, have weak compliance to the entry logs, which is also posing difficulties for the epidemiological investigators as well. And as for the nightlife entertainment venues, they also have illegal operations, hiring illegal supporters and helpers, and also they have not abided by the operation hours as well. And if we do really go into another fourth wave of infection, we believe that it will be very difficult for us to contain the virus going further, despite our government's vaccination program. It is very important that we continue to contain the virus until June, when we carry out the vaccination program for the senior citizens, which are highly susceptible for the virus. And we also have the nursing hospitals and nursing care centers, which are in the finishing ends of the vaccinations, and they are seeing a rapid decline of the infections. And we also have many room for hospital beds as well. And thanks to the management of these nursing hospitals and nursing homes, we also have seen the daily tally regarding these facilities decrease from 300 to about 110. We also have many hospital beds right now, over 8,000 of them for people people with light symptoms or moderate symptoms nationwide. And considering all of the situation comprehensively, we will be adjusting the social distancing measures, and we also have been opening our ears to the local governments as well as our panel of experts. And we will be moving towards the tightening of the social distancing measures. However, we believe that increasing these measures rapidly, we believe that there would be concerns from certain circles of life. Therefore, we will be also intensifying and strengthening the importance of responsibility and authority when it comes to the social distancing measures. And we believe that our basis was the need to heighten the sense of responsibility and duty of these multi-use facilities as well. And considering all of these opinions, we will be adjusting the measures, and they are as follows. First of all, the current social distancing level of level 2 in the capital area and level 1.5 in the non-capital area will be maintained. And also gathering ban of public gatherings of 5 or more people will also be maintained as well. However, the local governments will have the authorities or the discretion and freedom to decide on their own elevation of the distancing measures. And the Busan is also mulling over intensifying its social distancing level to level 2 as well. And we believe that heightening the social distancing level all at once will also have a large impact economically on the livelihoods. We will be maintaining the current level of social distancing level. However, we will be restricting the uses and the operation of the multi-use facilities centering around high-risk facilities. Moreover, we will be intensifying our quarantine measures in the capital area. And as for the cluster infections and as for the nightlife entertainment venues that are prone to large cluster infections, we will be having a gathering ban on all of these facilities. And they include clubs, pubs, as well as holding pubs as well, and other similar facilities as well. And all of the multi-use facilities that have been under the operating hour to 10 p.m. will also be shortened until 9 p.m. if there are continued risks. And as for singing rooms, if they have illegal operation of hiring illegal helpers or also breaching these operating hours, we will be intensifying these penalties with the help of the police agency. And at department stores, we will be restricting all of the people to have food samplings and also intensify quarantine measures as well. And at public saunas and bathhouses, we will be intensifying our quarantine measures, including a massive testing of all of the people who work at these facilities. We will be also expanding the massive testings for any people with clinical symptoms of COVID-19. And in the metropolitan area, as for the people who have been recommended to get tested by the pharmacies and by doctors, we will also have an administrative order so that they can be tested within the next 48 hours. And if they do not apply to these testings or they do not get tested and they are confirmed to have COVID-19, they will be faced with stern legal measures and also penalties, and no support on treatment or living allowances will be provided for them as well. And other words, we will be also intensifying our quarantine measures for other types of high-risk facilities, which include call centers as well as large dormitories and also many business places that are operated under confined and crowded environments. And we will also enable the workers here in the metropolitan area to also have flexible working hours, and we ask for the support of the corporations going forward. And also in February, we have been carrying out large and intensive monitoring and inspection and crackdown for religious facilities, and these places of worship will also be faced with intensified quarantine inspections as well. We will be intensifying our quarantine inspections for education facilities, including preschools, kindergartens, and schools as well. And also we believe and we hope that the basic quarantine measures will be also largely promoted to the public, and we will also have a good propaganda of these public quarantine measures to the rest of the public. And we will also have the principle of intolerance for people who breach and violate these quarantine measures. And also the facilities that breach these operation hours will also face a gathering ban going forward. And we believe that these measures will be implemented for the next 3 weeks until the May 2nd, starting from April 12th. And considering the fact that we will have difficulties in containing the virus going further, in a short period of time, we will be extending and having the measures put in place for the next 3 weeks. And we believe that we are faced with the initial signals and signs of the fourth wave. We need to take stern measures. We need to exert our full efforts to contain the virus going further. We cannot overcome the COVID-19 virus and the pandemic only with the government's quarantine measures. We need the public's participation and also perseverance. We ask the residents in the metropolitan area to restrain from having gatherings and also travel. Luckily, the elderly and senior citizens in the nursing hospitals and nursing homes, they have been inoculated under the government's vaccination plan starting from February, and we have been able to contain the large spread of the virus here at these specific facilities. If we are able to finish our vaccination program targeting these people, we believe that we will be reducing the further risks of infection for our seniors. And we ask for your continued participation and perseverance that you have exerted for the past year. And we ask for you to also tighten the level of quarantine measures as well and your participation in these measures. And if you are also target of the eligible vaccination recipient, we ask for you to get vaccinated. And also we will exert our full efforts to return to a state of normalcy as soon as possible. Thank you very much.
That was a government briefing on the COVID-19 situation here in the country. South Korea reported 671 new COVID-19 cases on Friday. This brings the accumulated number of cases to 108,269. There have been 6 more deaths, raising the death toll to 1,764. We'll wrap up the coverage here, and we'll be back at 12 p.m. Korea time for our midday news with Mark Broom. Bye for now.